Hello viewers, I am back again and wishing you all a very happy Epilepsy Awareness Month. मेरे साथ आज हैं डॉक्टर अबीर गोयल, a neurologist from Paras Hospital Panchkula. And welcome Dr. Abeer Goel. And
Thank you, and my hello to everyone. So yes, celebrating this month, the month of November, as Epilepsy Awareness Month, and I hope that through this session we are able to generate some buzz about epilepsy and some awareness about epilepsy, not only amongst the people living with epilepsy, but also amongst the normal population or amongst the the colleagues or the family members of epilepsy. So yes, I'm so glad that we are discussing on this and you invited me for this. So I think let's hit the session.
thank you so much. I must tell you, मैं आपको बताना चाहती हूँ, when I was referred to Dr. Abeer by Dr. Parampreet Kharbanda, I was a little nervous to go to a new neurologist. होता है ना थोड़ा सा to go to a new person. But in Dr. Abeer, I found not only a neurologist, but also a kind of a therapist. I mean, he was so warm, he was so compassionate. मैंने मतलब दिल खोल के मैंने बात की है. I am not here to promote his hospital. I'm not here to promote him, but I found in him actually a warm human being. So patients who are in Tri-City, you need a doctor who's not only a neurologist, but also a therapist. Believe me, he's the one. Believe me, I have to confess here, one of my sessions, meetings, not sessions, one of my appointments, OPD appointments with him, I actually started crying because I think I just had so much built up in me or something I was going through. And he was so calm. He was so, usually doctors are, full of stressed in the OPD. But Dr. Goel was so calm and compassionate, which बहुत कम doctors होते हैं. So I was like, I have to get him to talk to him about epilepsy and few questions I wanted to ask him. तो आज हमारे साथ हैं Dr. Abeer Goel, and I'm very very excited for this session today. तो डॉक्टर अबीर, कुछ सवाल मैं आपसे पूछना चाहती हूँ. आपने न्यूरोलॉजी क्यों चूज की? मतलब कोई और फील्ड एज अ डॉक्टर क्यों, जब आपने एमबीबीएस किया तो न्यूरोलॉजी क्यों? आपको क्या ह्यूमन ब्रेन फैसिनेट करता था? क्यों चूज की न्यूरोलॉजी क्यों?
True to that sense that yes, human brain did fascinate me always. So I remember, when I had entered, since childhood, I know I had that kida of being a doctor. But I remember since my childhood, I always, used to tell everyone कि मैं तो cardiologist बनूंगा, तो heart का doctor बनूंगा. And probably that is how things have been, ingrained in our head कि heart का doctor is a big doctor. But I remember when, I started my MBBS, my first point of training of being a doctor. So that time, the human brain did fascinate me a lot. In fact, for me, it was more like a mathematics or more like 1+1 is 2. Because amongst all the branches, sub-branches of medicine, I think neurology is one in which you tend to think a lot. It's a lot of deduction. So, as a child, when we are very fascinated by things like Sherlock Holmes and, Byomkesh Bakshi, so neurology gave me that and gave me that platform to be a Byomkesh Bakshi or, a Sherlock Holmes by myself. So that was the initial push for neurology, I must say. So even, in the MBBS days, I used to, teach my colleagues, my batchmates, my juniors for that. But then very frankly, as I, progressed into MD, the mind did sway away and I thought, okay, maybe some other branch I might do. So one unfortunate thing happened in my life, and one of my juniors, she had got a stroke. So and at an early age, and she had got a stroke, and caring for her and post-stroke, she had also got a seizure. So hence, she had got a symptomatic epilepsy.
Stroke means as a brain stroke.
A brain stroke. So she had got a clot in the brain, and following that, she also had a seizure. And somehow that incident, that was actually 2 days before my MD exam, and she was a good friend of mine. So after that, she came, she was flown from Karnataka down to Chandigarh for a rehab, initially in PJ, then in Chandigarh for rehab. And, while tending to her, it was something else dawned upon me. The thing was that neurology is not only about diagnosis. Neurology and its ailments are not only about diagnosis, but also about taking care of the patients. If there was a myth that neurology में किसी चीज का treatment नहीं होता है. So as I said, it's a myth. There are a lot of things. Yes, definitely neurology में काफी चीजों का treatment नहीं होता, but जिन चीजों का treatment होता है उसमें भी there's an equal importance of rehabilitating them. Not only we need to diagnose a disease, but even with the rehabilitation part, be it a social rehabilitation, be it an educational rehabilitation, be it a vocational rehabilitation. So it was really, touching when, we worked together in during my friend's, battle throughout her disease, and we could help her get back to being a doctor, and now she's a successful doctor by herself.
That's
So
amazing.
that part really, inspired me to become a neurologist. And so here I am. And that is where, it really helps upon just listening to the patients, talking to them, even if you're not being able to treat them fully through your medicines. But I am of a belief right now, just listening to them, talking to them, probably just saying, yeah, okay, fine, I understand. And caring, that matters a lot to the patients. In
Yes,
short, calming their
I have
nerves down.
experienced that. Yes, yes. I've experienced that.
Yeah. So
जैसे आप सुनते हैं, you are so patient. You're so patient. You're so patient with your patients. I've seen you even when I sit outside your room, OPD. आप कितना time देते हैं patients को? I've seen that. Yes, half the patients
that
का आधा आधा दर्द निकल जाता है if the doctor is compassionate. आधा
very
pain
true.
निकल
That
जाता है.
is true.
Yes,
That is
yes.
true. That is where probably we should understand as a doctor, as a patient. One very, I'm a cinephilic, so I like a lot. I watch a lot of movies.
Mm.
So I remember that I once had watched a movie called Patch Adams. I'm not sure if you have watched it. So
No, I haven't.
do watch this movie called Patch Adams. It was a inspiration for Munna Bhai MBBS.
Okay.
So there's a dialogue in Patch Adams in which they actually explain what is a doctor. So in that, the protagonist, played by Robbie Williams, so he says that everyone is a doctor. Everyone who listens to the other person's, complaints, or other person's, everybody who just give a, shoulder to cry upon, who gives a shoulder
Yes,
to cry
yes.
upon, is a doctor. So that thing really, touched me. Ki, chalo, yeah, the probably that is the real meaning of being a doctor. And so yes, and what I've generally seen is that in neurology, especially with epilepsy, there are a lot of things, there are a lot of misconceptions, myths. There's a big void in understanding of the epilepsy part, the understanding of how we care about the epilepsy. Do we actually need to, worry a lot about this epileptic, people living with epilepsies? So I guess, and I'm so glad that I met you, even through Dr. Param's, reference, that, apart from, being a patient, you're actually being a mentor, and the need of an hour, because everywhere we have, support programs, everywhere we have groups, support sessions and groups. And I'm so glad that you are mentoring a lot of, lot of patients of epilepsy. And
I'm just trying.
I
I've
will not.
woken up. I'm woken up very late in life. I'm at 50. I'm trying now before it's too late. Before I just my call comes. I'm trying.
If
I
you
I
if you
I
remember it, the second time you met me, you had given me one of your books, which I have actually kept in my OPD. Uh,
yes, epilepsy.
so I'll be very frank. I've read some part of it, but dude, I was floored by this, and the reason I've kept it in my OPD is because a lot of not only epilepsy patients, a lot of neurology patients who are somehow not doing well when it comes to being the psychological support, I do tell them to go through this book. I just ask
What
them
did
to
you
read.
like? What did you like about the book? Even I have a copy of it. What did you like most about the book, Dr. Goel?
There was one ode to you by your daughter. I'm guessing that she's also a doctor,
Yeah, yes, yes,
and yeah, by Dr. Harsheen Kaur.
yes, yes. She's
So,
passed out to the
reading
same,
her, okay,
passed
so
out from
reading
the
her
same
chapter was,
same college as you, 32 sector.
oh,
Yeah,
32,
32
okay.
hospital.
So,
Yeah.
so reading her, this thing, reading her chapter was like going through a book, going through a movie of an epileptic patient. I am guessing she has described a lot of things about you, and I loved that the way she had described. Well, I would really recommend that everyone who has an epilepsy should read about this. The reason for that is it has picked up upon a lot of things, a lot of internationally put across as to should you drive or not, what is the status of stress on your epileptics, what is the status of anti-epileptic anti-seizure medications on the memory, and how should you manage, what is well, it's easy for me to talk about it, it's easy probably for you to talk about it, but when it comes to the the attender's perspective as to what do they see. In fact, the first paragraph what I read, when she actually describes the first time she saw you, and one of the
Then
lines in which she says that she could feel the bed moving like an earthquake. I'm it was such a nice thing to read something which we probably as a doctor we tend to hear it and we don't feel about it much. From a bystander's point of view, how they feel it, they probably go through that. So I mean, there's so many practical points in that chapter written by your daughter, who is also a doctor. So I'm so glad that she could write that chapter both from a patient's bystander point of view, from a doctor's point of view, probably covering the whole thing, what could have been there. So that chapter really touched me, to be very frank.
this this book, Dr. Goel, is a anthology by 8 epileptics who've contributed their stories, their journey, and including me. And it's been published by Vitasta Publishers. And it's also been translated into Hindi, ताकि we can reach a wider audience. And I hope in future we can translate into further different languages, ताकि और लोगों तक पहुंचे. It's available in
I mean,
Amazon.
I really hope that we get more, part two, part three, part four of this book, so that
I hope so.
more and
I
more
hope.
people could open up about their experiences.
Yes, I, for viewers जो ये वीडियो देख रहे हैं, आप प्लीज आइए. The aim of these videos is कि please contact me or contact Dr. Goel, message me on Instagram, Facebook. Just come out in the open. I am there to interview you. Now coming back to Dr. Goel. Dr. Goel, आपने मेंशन किया था आप कर्नाटका में पढ़े हैं. सो ये जो लोग नहीं निकलते बाहर, बताना नहीं चाहते कि उनको एपिलेप्सी है, उनको डर है कि करियर खराब हो जाएगा, मैरिज नहीं होएगी. द स्टिग्मा इतना हाई है. तो कर्नाटका में भी, साउथ में भी इतना हाई है, क्योंकि जैसे पंजाब में, नॉर्थ में है, क्योंकि आप वहां पढ़ के आए हैं. Because I know people who are in Bombay, Pune, they are having large NGOs about holding NGOs about epilepsy. And I have friends who are like Yashoda, my friend Yashoda, she's conducting marriages between epilepsy patients. So but up north the stigma is very deep. So how do you feel the difference in the thought process? Stigma जो साउथ में है, वहाँ people are more open minded, and नॉर्थ में people are very narrow minded. Do you feel the difference आप जब up north आते हैं, आए हैं?
No, I wouldn't really put it up that way ki, about the mindedness, as in the North people are more narrow-minded or the South people are more broad-minded. The whole thing, the whole difference, what I personally believe is the impact of education. In South, what I've seen is, yeah, more and more people are educated normally. Formal education is more prevalent in South as compared to North India. So hence, people are more understanding about the the disease part, the epilepsy part. In fact, very
Right.
funnily, especially in Karnataka, we have a very distinct epileptic syndrome called hot water epilepsy, in which a lot of patients, they just pour hot water on their head and they get one epileptic attack. So that's very, very, very distinct for people living in Karnataka. So yes, as you rightly said, there is a there is a difference when it comes to different type of how people are perceiving epilepsy. But the good part is what I am seeing in the last 15 years is there is definitely a change. There's definitely a shift in the tide from people having a stigma of epilepsy to people accepting epilepsies.
Yes.
Yes, there is a difference when it comes to North and South in a bit of understanding of epilepsy, but again, what I would stress regular and continuous efforts by people like you, people like your friends you just named, who have actually been working tremendous, marrying people with epilepsy, for rehabilitating people with epilepsy.
Yes.
Yes, things are changing and we are definitely moving into the right direction. But having said that, we definitely need more and more people to come up, open up about their experiences, open up about their experiences to others, so that let's our main aim should be, let's not make it a stigma anymore. Let's accept it, just like we have accepted BP, sugar, we have
Yes.
accepted
Yes.
fever.
Yes. Hmm.
Let's accept the epilepsy part and make it as probably normal as possible.
अब एक मैं सवाल पूछना चाहती, जो बहुत लॉट ऑफ पेशेंट्स आस्क मी, का मतलब आपसे भी पूछा। यूजली लोग का इतना स्टिग्मा इतना डीप है, वो डायरेक्टली डॉक्टर से भी कभी कभी डरते हैं पूछने से। ये पूछते हैं कि जैसे अगर सीजर नहीं हुआ, एक आध महीने के लिए, 6 महीने के लिए नहीं हुआ, तो हमें एपिलेप्सी नहीं है। इज दिस ट्रू और नॉट, कि हमें कुछ महीने तक सीजर नहीं हुआ तो हमें मतलब हमें
No, no, no,
एपिलेप्सी नहीं, हम ठीक हो गए? इज दिस ट्रू?
no, no, no. A
मतलब
very
दे
valid
उनको
question.
लगता
What
है,
we
उनको मतलब दे फील दैट वी डोंट हैव अ सीजर, वी आर फाइन, सो दे विल स्टॉप टेकिंग मेडिसिन, दैट काइंड ऑफ थिंग
no,
इज
no,
देयर।
no. There needs to be some clarity on this. I mean, you're actually right about the myth. What many people, they self stop the medication thinking कि यार हमें तो सीजर नहीं हुआ, एक दो महीने निकल गए, अब तो दवाई बंद कर देते हैं. So the whole
हाँ.
part is there's a difference in seizure and epilepsy. What we generally say by definition epilepsy is, अगर किसी को दो से ज्यादा बार सीजर आया है, या फिर उसको सीजर आने की दोबारा टेंडेंसी है, तब हम कहते हैं कि पेशेंट इज एपिलेप्टिक, इररिस्पेक्टिव ऑफ द पार्ट कि उसको दोबारा सीजर आता है कि नहीं आता. सपोज करो मेरे को अभी एक सीजर आया, 2 हफ्ते बाद या हफ्ते बाद दोबारा सीजर आ गया है, without any inciting factor for the seizure, then I will label myself as an epileptic, and then I need to start a medicine for that.
हम्म.
Now that medicine, another, adding on to this myth, there's another myth कि भाई हमारी तो दवाई 3 साल चलेगी, 3 साल के बाद, हमें डॉक्टर साहब ने कहा था 3 साल चलेगी, 3 साल के बाद हमारी दवाई बंद हो जाएगी. So that is not true for every case. What everybody needs to understand is 3 साल का जो magic figure है, that is not true for every case. Let your neurologist decide. Don't just talk to any doctor or anyone, and don't believe on this hearsay कि भाई 3 साल ही दवाई चलेगी. Don't believe on the fact कि आपको अगर सीजर नहीं है तो आपको एपिलेप्सी नहीं है, अगर आपको सीजर नहीं हुआ तो एपिलेप्सी नहीं है. सिर्फ और सिर्फ हमारे पास कुछ टेस्ट होते हैं, कुछ चीजें होती है जो हमें बताती हैं कि दोबारा सीजर, आपको अगर आपका सीजर कंट्रोल में है. आई हैव हैड पेशेंट्स जिनका 2 साल सीजर कंट्रोल में रहा है, 2 साल के बाद सीजर दोबारा आ गया है विदाउट डूइंग एनीथिंग. आई हैव हैड पेशेंट्स जिनका 3 साल के बाद, 3 साल कोई सीजर नहीं था, उनकी दवाई कम करते करते सीजर आ गया है. आई हैव हैड पेशेंट्स जिन्होंने 3 साल दवाई खाई, किसी ने उनको कह दिया था कि दवाई बंद कर देना, उन्होंने एकदम से दवाई बंद कर दी है एंड उनको सीजर आ गया है. सो there are lots and lots of misconceptions about this. In fact, there are lots of misconceptions about epilepsy and seizures. So my suggestion is, do talk to your neurologist, clarify each and every point regarding this. It's not a rocket science to clarify a lot of things about seizure and epilepsy. It is a very easy thing. Just you need to sit down for 10 minutes, jot down every this thing, any doubt you have, clarify your doubts, and even if
and
your
self
doubts are not
medication ना
clarified,
करें, मतलब self medication ना करें.
बिल्कुल
हाँ
सेल्फ मेडिकेशन भी ना करें, सेल्फ स्टॉपेज ऑफ मेडिकेशन भी ना करें.
हाँ हाँ हाँ.
Both are equally bad for an epileptic patient.
हम्म.
So yes, ये सारी चीजें हमें, it's what I call them, it's an practical obstacle, practical obstruction जो हमारे real life प्रैक्टिस में हमें पता चलती हैं. So I guess जो the message should be, not every epileptic needs medicine for 3 years. Kindly discuss with a neurologist. अगर आपके MRI में कोई दिक्कत है, अगर आपके EG में कोई दिक्कत आ रही है, तो हो सकता है आपको दवाई लाइफ लॉन्ग चले, हो सकता है आपको दवाई लंबी चले. 3 साल के बाद दवाई एकदम से बंद नहीं होती है. अगेन, डॉक्टर न्यूरोलॉजिस्ट धीरे धीरे दवाई टेपर कैसे करनी है, कितनी स्पीड में दवाई टेपर करनी है, टॉक टू देम रिगार्डिंग दैट. कुछ सीजर्स होते हैं जिसमें आपके बनावटी तौर से टेंडेंसी है सीजर आने की, उसमें भी दवाई आपकी लंबी चले. ऐसा नहीं है कि 3 साल के लिए दवाई चलेगी. कुछ सीजर ऐसे होते हैं जिसमें मुझे पता है अगर मुझे एक ही बार सीजर आया, लेकिन मेरे पास MRI ब्रेन में कुछ है जिसके कारण मुझे दोबारा सीजर आ सकता है, तो इररिस्पेक्टिव ऑफ द फैक्ट कि आपको एक ही बार सीजर आया था, फिर भी दवाई लंबी देर चलेगी. कुछ सिनारियोज होते हैं जैसे अगर मुझे कोई पहली बार सीजर आया है, आई रियली डोंट वांट the old patient to get another seizure for the fear of falling and sustaining a fracture. उनमें दवाई चलेगी. So it's a basically individualized approach. Every patient is different and every plan is different.
Right,
So
right.
discuss your plan with your doctor, discuss your plan with your neurologist, and follow it accordingly.
Because each patient, each seizure is totally personalized, it's totally different. It's totally different.
Yeah. Every individual is different, even when it comes to
Yes.
seizures. Yeah.
So आखिरी सवाल डॉक्टर साहब, last but not the least, आप इतने पेशेंट्स देखते हैं, so many in a day, and so जब आप घर जाते हैं, is Dr. Abeer Goel the same person who goes home as a husband, or he's a totally romantic, loving husband, or is he a doctor at home also with a
Uh,
doctor wife? This is a
yeah.
personal question, and but
Thanks for putting that
we
up.
need an answer. We need an answer. India wants to
So
know.
yes, it's a very it's a very conscious effort to be a very different person at home. Trust me, I have a neurologist wife. She's also a neurologist, Dr. Nikita Dhar, and
Yeah.
even though we have the same branch, we have the same kind of patients, we have the same conversation, but it's our conscious effort to leave the work thing at workplace, and continue completely different when we reach back home.
नहीं,
So
but
yes, very frankly, sometimes
temptation नहीं होती to discuss a particular case, to discuss patients. Temptation तो होती होगी.
some, some sometimes we do, but a lot of times we tend to chill out in some other way. Either we watch something, or we go on a walk, or we do something else. But yeah, temptation hoti hai, but we tend to curb on that temptation. And that's what I tell everyone also, that don't take your work
Yeah.
at your
Home.
at your home place. Don't
Yeah.
carry that around.
See, viewers, that's what I said. He's more of a therapist than a neurologist. With that, I'll end this session. Thank you so much, Dr. Goel. Thank you for giving us your time.
Thank you. My pleasure, and I hope that more and more people connect to this, and
Yes. Yes.
we could get more and more awareness to the people around.
Yes, I hope patients, caregivers, parents, family members, please contact us, message me, call me, and come out in the open. Epilepsy is a very, very minute part of you. Please do not let it consume you. Please उसको consume मत करने दीजिए. आपकी जिंदगी बहुत बड़ी है. इसको अपना एपिलेप्सी को अपने आप इतना भावी मत होने दीजिए. Life is very big. Make it large. Thank you so much, Dr. Goel. Thank you for being part of our session. Thank you. God bless you, and
My pleasure.
happy Epilepsy Awareness Month. Thank you.
Awareness. Thank you.